Okay. All right, well, ladies and gentlemen, the third time was the charm, so please welcome Dr. Jeff Kurtz to Phoenixville Public Health.
Thank you, everybody. I apologize if you came the last time that I wasn't able to make it. The first time, my daughter was born. She was born a little bit early, so the second time I had my hands full with her, and for some reason didn't get the notification. So I made it. I'm here.
How old's your daughter?
She's 5 weeks old now. Yeah. I'm running on 0 sleep after last night.
Sorry.
If I need to kick it over to Dr. Nick, Dr. Nick is here. He's one of our staff therapists in our Phoenixville location. So I'm the clinic director at our Phoenixville YMCA location. We're located right inside of the Phoenixville Y. We have access to all the equipment there. Great thing is that you don't have to be a Y member to come see us there. But I'm also the clinic director of our Collegeville location as well. We have 7 other locations located throughout Chester, Montgomery, and Delaware County, but the 2 closest ones would be Collegeville, Phoenixville. All right. We're always scheduling new patients, so our contact information is going to be at the end of this. Right. If you have any questions, just feel free to raise your hand. But you know, there's a lot of stuff that we're going to cover, so we might get to your question at some point. But if you have something specific to this slide, just let me know. All right, so what we're going to be working on here tonight is learn about the incidence and importance of falls, who's at risk for those falls and what causes them, and then how can we reduce falls ultimately, because that's what we're all here for. All right, so the first thing about falls is a fall is an event in which somebody comes to rest that they didn't intend for on the floor. Okay? It's the leading cause of fatal and non-fatal injury amongst 65-year-olds. There's some numbers, some staggering numbers about how many injuries we treat because of falls. But ultimately, 1 in 4 older adults will fall each year. In the past 12 months, how many of us have fallen? Okay, so not too many. That's great to see. I myself fell down the stairs a couple of weeks ago, or a couple months. It was a couple months, right? A couple months ago. You know, it happens. There's some things you can avoid. There's some things you can't avoid. It's just putting yourself at a lower risk as humanly possible. All right. All of these things become more and more important the older we get, and we'll talk a little bit about why that is. Again, there's some more numbers here, but 1 out of 5 falls leads to broken bones or head injuries. So, you know, some of us fall and we don't really sustain a large injury besides, you know, a bruise, but that can't be said for the next fall, and that's always the concern. All right, so who's at risk for a fall? Everybody. So older adults and young children are the highest risk groups. I have a 2.5-year-old at home who falls all the time. But the great part about the young children is that they are only, you know, 2.5 feet up from the floor. Right, so when they do fall, it's not a long fall. But the ones that we have to really worry about are some of the older adults, just because it's a lot further of a fall. There's things like brittle bones, other things that we have to worry about there, hitting head. But then there's also many risk factors associated with aging that can also lead to falls. So it's not just age. You know, everybody says, well, I'm at risk of falling, I'm getting older. It's not really the act of getting older that seems to make people fall more. It's some of the other things associated with aging that can result in a fall. All right, we'll talk about what those things are. All right, so there's different types of risk factors. There's 3 really big ones: behavioral, environmental, and biological. All right, some of these we can help, some of these we cannot. So why don't we start off with behavioral risk factors? So some things that might bring us to a higher risk of falling would be, you know, medications. It could even be actions, emotions, and daily choices. So somebody that's on low sleep might be at higher risk of falling. You know, poor dietary choices, not being adequately hydrated, those sorts of things can kind of lead us to a higher risk of falling. But things that I mentioned here would be medications, risk-taking behaviors, poor assistive device adherence, or having the wrong assistive devices. Everybody, you know, they choose a cane, they choose a walker, they choose a rollator, but it might not be the perfect thing for you. So getting that evaluated is important. Footwear and clothing would be another one. Gait speed, and then fear of falling. So a lot of people might think an increased gait speed, which would be walking faster, would lead you to a higher risk of falling. It's actually the opposite. We see people that walk slower actually have a higher risk of falling. So if you want to fix your falls, just walk faster. Run it. Right? No, but actually gait speed is one of the highest indicators of life expectancy. Right? So if you see that somebody's gait speed is going down, it's actually that their life expectancy is directly correlated with that. Right? It's one of the best indicators of musculoskeletal and cardiovascular health. Right? Another big one would be fear of falling. Right? So I spoke to a few people here that had fallen in the past, and immediately they have a fear of doing it again. Right? Even some people who haven't completely fallen might have that really big innate fear of falling. We actually see that a fear of falling increases the risk of falling by 70%. Right? So, like I said with the gait speed, just don't worry about falling and you won't fall. Right?
Walk faster.
Yeah, walk faster and don't be afraid. Right? One of the big things that happened. What happened 3 years ago? Anybody know?
COVID.
Right. We all stopped walking around. We all stopped being physically active. That reduction in activity and exercise directly correlates to falls, risk of falling. Right. So even if people didn't contract COVID, COVID was a big one, especially in our older population, because we all stopped moving a lot less. We're all a lot more fearful to actually get out of the house. And now that things have kind of calmed down and we all want to get out of the house, we're talking to a lot of people where they say, I'm just fearful at this point because I haven't moved for 2 years. So that's something else that we're dealing with, especially over the past 3 years. All right, so how can we reduce these behavioral risk factors? So a medication review. We all have a really good resource over at Gateway Pharmacy, if you guys know where that is. They do free medication reviews where you can bring in your list of medications. They'll say this and this are reacting with each other, and that could actually be leading to dehydration, poor diet, actually getting dizzy or off balance. So that would be one that you could always take advantage of. Making decisions that favor safety and consider other risk factors. So this is just kind of taking note of your life, and we're actually going to talk about the household and basically what you can do to reduce your risk of falling just inside of the home. All right. But making decisions that favor safety could be, if you know there's a spot in town where it gets really uneven or you don't like walking. Just being aware of those scenarios and making a good choice, especially as you notice that maybe your balance is getting off. That would be something that you can analyze. All right. Not wearing glasses. Some of us don't like how we look in glasses, and we say, I'm not going to wear them unless I'm driving. That would be another one. We're going to talk a little bit why that might leave you at a higher risk of falling as well. All right. The proper clothing and footwear. All right. Everybody likes the sandals. Everybody likes showing off their pedicures and everything. But sometimes the best choice for you would be to be wearing closed-toed shoes, shoes that are more supportive, more appropriate for the activity that you're going to be doing. If you're going to be walking a mile, maybe choose shoes that are going to be there for you, the last half of the mile. The other big one would be shoes at home, right? According to a study, you're 2.27 times more likely for a serious injury from a fall without shoes on at home, right? So just even if you're in your home, wearing proper shoe wear for that is something that you can do. And then, like I said earlier, prepare yourself to walk faster with more confidence. And that's something that takes practice. It's not like you're going to walk out of here and just walk faster. All right, some of the other ones would be the environmental risk factors. So some things like poor building design, slippery floors or rugs, uneven sidewalks, insufficient lighting, and pets, our loving pets that love to trip us all the time. I can't tell you how many people I've seen for fractures because they tripped over their dog or their cat. Right? So how do we minimize these environmental risks? Right? We use home field advantage. It's the one place that you can actually alter your own environment. All right? So less is more, especially when it comes to walkways. So just reducing clutter. I'd hate to see any of you walk in my house right now with all the toys and stuff around the house. And that's just myself. That's not my son. Yes, all over. Adding lights or using LED light bulbs with higher lumens. All right. The number one way people fall in their homes is poor lighting, and it's usually at night. Okay. So again, we'll talk a little bit about how you can address this, and then some options for your loving pets would be audible pet collars, so that they don't just sneak up on you. You always know where they are. All right. So if we look here at an example, there's 4 things that could be fixed to kind of improve the safety of the home. All right. So number 1 would be cleaning off the nightstand. All right. That way you don't have to reach for unnecessary items. Okay. A less cluttered floor, just so you don't trip on your shoes. You'll even see the rug there. I mean, people love their area rugs, but not knowing and not being aware of one rug and where it transitions into a different flooring or a different rug is a big way that people fall. All right, number 3 would be one of those life alerts or the life phone that you can easily reach in case a fall does occur. We spend so much time trying to avoid falls, but we also need to be prepared in case we do fall, especially if you have a history of falling. And then just better furniture placement. So, the legs of the chair that kind of stick out in your walkway, and 9 out of 10 times you walk by there and you're okay, but then there's always that chance that you catch it. All right, especially if it's just moved just slightly off. All right, here's another one. This is the staircase. This is really one place that you do not want to be falling. So number 1 would be a handrail. Okay, so adding a handrail either on one side, both sides, can really be a big help, especially if you end up having some kind of joint-related injury where you'll actually benefit from having that handrail. Cleaning the stairways, just like we talked about, reducing some of the clutter. And then the other one's stairway lighting, right? So there's a lot of those stairways that don't have proper lighting. And we'll talk a little bit, again, why that increases risk of falling, would be lighting. All right, here's another one. Can anybody pick out any so far?
Oh, those wires.
Yeah, so number 2 is the cords, right? Number 1 is that area rug that people really like. Number 3 looks just like more organization issues. Okay, so just reducing. I mean, people have cords that go from lights, cords that go from phones, just in the wrong places. Okay, I believe this is the last one. All right. Number 1 would be a better organization. Right, so it's actually putting things that you typically use in more reachable areas. Right, if there's objects that you don't typically reach for because you don't use it very often, put it at the higher to reach areas. Or if you have a tough time bending over to pick something up, then put that in a more convenient place for yourself. All right. Number 2 is, again, that pesky area rug, especially in the kitchen where a lot of us have tile, hardwoods, and we kind of like to have that area rug. You can either get the pasties that kind of stick on the corners so that they don't fold up, or just get rid of them altogether. And then, again, the pets are another big one, just having some stuff in your way. I think I have the world's sloppiest drinker in terms of my dog, so my floor is just constantly wet. So that's something that you can address as well. Any questions so far about environmental, behavioral risks of falling? All right, so this is the hardest one for people to change. Unfortunately, it's one of the biggest reasons people have falls. All right, so this would be the biological risk factors: age, gender, race, and then the big ones would be their chronic illness. So COPD, depression, arthritis, circulatory disease, those all increase about 32% your risk of falling. All right. Diabetes is a huge one. Big reason for that would be diabetic neuropathy. So just the inability to feel through your feet, that's going to slowly start to creep up a little bit to almost where your sock line is. That's where footwear, shoe wear, and proper hygiene of your feet is really important, right? So there's actually shoes that are recommended for people with diabetic neuropathy. You can also get those at Gateway Pharmacy as well, and they'll really help you with picking that out, right? Parkinson's disease. With Parkinson's disease, we see that people tend to shuffle their gait a little bit more. They don't pick their feet up as well. So your foot might get caught a little bit easier. You also see that posture starts to get a lot worse, especially with Parkinson's, as well as just older age. We'll talk a little bit about why that occurs. More neuropathy and then multiple sclerosis, just some of the neurological diseases that, first of all, we have to identify, and second of all, we have to reduce the effects of those things. Okay. The other one would just be general physical or cognitive decline that's associated with aging.
Hold on.
Yes.
Why do you have race up there?
Probably because there is some correlation between race and falls, right? It's not necessarily that individuals with a specific race are at higher risk of falling biologically, but more so it could be all of the different issues that we see in terms of economic, economic things. So people with lower socioeconomic status have higher incidences of poor dietary choices, certain things like that.
Yeah.
Yes.
What about vision, like macular degeneration?
Yep.
You get into that? Or?
Yep,
Okay,
we are.
so I was going to say your eyesight recovery.
Yep,
and bright.
that's a
Okay,
great point.
thank you.
Yep.
And something like osteoporosis, is that a factor?
A little bit. It's more of a concern of when you do fall. That's more of a concern. Sure, there's a small correlation between osteoporosis and just muscle weakness, but the best way to offset osteoporosis is muscle strengthening and is weight bearing, right? So really for people with osteoporosis, it would be better for you to weight bear and strength train to slow the effects of osteoporosis, right? That's a good question. Some more other issues that come along with the biological side would just be, again, the physical decline. Vision, right? 33% of 65-year-olders will have some form of macular degeneration. Next slide, I believe, or the one after that, I'll talk about why that's so important. Strength. So every decade after turning 30 is associated with a 10% loss of strength. Nick is still reaching his peak. Right? A lot of us are on the other side. Okay? So, if you're 70 years old, that's 10% over every 10 years, that's, you're 40% down. Some of those things can be slowed, but really you hit a point in your life where you're on the downslope, and unfortunately it's pretty early, okay? And then the balance systems, right? This is the big one. So the balance systems, there really are 3/4 of them, okay? Proprioception is essentially your ability to, your joints being able to tell you where you are in space, okay? Everybody can close their eyes and touch their finger to their nose because of proprioception. It's basically your shoulder telling you, I'm over here, my elbow's here, my finger's here, my nose is here, okay? These are all things that start to get worse as we get older. However, on the other side of it, it's all things that can be trained and improved, okay? So proprioception is something that we train at physical therapy. You'll see this young lady here bouncing on a foam pad. That's going to challenge her body to basically, challenge her proprioception. She's not exactly sure where her ankle is in space or her hip is in space because she's getting an uneven surface. She's getting feedback from the floor that's not necessarily true. Right. The next one would be tactile input. So it's basically your feet coming in contact with the floor. When we walk around, most of us walk on 2 feet. That's your only point of contact with the floor, right? So if you're not properly feeling the floor, you're not actually going to get the feedback from the floor that you want. That's why a lot of people choose to have a cane, is because they get one more point of contact with the floor where they can say, okay, here's the floor, and it's 2 once you have that walker, okay? Vestibular system. Some people suffer from vestibular dysfunction, which is where they get dizziness when they change direction, they change position. This is why a lot of us get car sick. It's essentially these little canals in your ear that basically interact with fluid and motion to basically tell you, I'm turned sideways right now, I'm turned backwards right now, right? This is all something that starts to degrade as we get older, but then a lot of people also have dysfunction where they just get dizzy when they change positions. It's usually that these little rocks and pebbles that are inside of those canals become dislodged, and then people start to have things like dizziness, vertigo is a big one if you've heard of vertigo. Those are things that can be corrected, right? But that's going to really help you in terms of balancing. And the last one is going to be your vision, right? This is when going to the eye doctor is so important, or wearing the properly prescribed eyewear. Okay? This is why having light in the middle of the night is so important. Because anytime you eliminate one of those four things, proprioception, tactile input, vestibular, and vision, you start to challenge your body a little bit more. Okay? We only have four tactics, we can't be losing one completely. So if I ask you to close your eyes, all of a sudden you don't get the input that you're getting from your eyes. Right? We're all basically using our eyes in some capacity. We're finding a spot on the horizon to get our body to be able to balance. And if you eliminate that or you impair one of those, it's going to be a lot harder for you to balance. Okay? Any questions about those big four? It all makes sense? Okay. This is a way that you can test your risk for falling. Okay? We offer this sometimes when you come to physical therapy. It's just to get a baseline of where you're at in terms of your subjective feeling of balance. Right? This is another test that we use called a 4-stage balance test. It's fairly simple. It's just balancing differently with your foot in contact with the floor. This is something else that we use at PT. You can do your own self-evaluation if you want to, but I think there's better ones to be done. All right, this is another test. These are basically all just tests that we use at PT to identify your overall health. Okay. So your vision screening. All right, so that was ready. That was all preparation and giving you some feedback on the things that go into balancing. All right, so we're going to move on to steady and go. All right. So what can we do ultimately to improve balance? That's what we're all here for. All right. So exercise is the number one thing that's recommended. Like we talked about earlier, gait speed is a huge one, strength is a huge one, and being able to balance is a huge one. Okay, so an exercise program that's going to challenge your balance system. It's going to challenge your muscle strength. It's going to challenge your mobility. I've seen so many people that have fallen because they don't have shoulder range of motion, right? So they're trying to reach up for something, they can't reach it, so they go like this to try to get up there, and now all of a sudden they put themselves at a higher risk of falling. And it's not because of their legs necessarily, it's because they didn't have shoulder mobility, right? I've seen people fall because, the one gentleman I'm thinking of reached for his towel when he was getting out of the shower and couldn't reach it. For some reason he was having a bad day with his shoulder and he fell that way. Muscle strength would be a big one. The ability to actually react to those falls is another one. So reaction time is something that slows as we get older. Bone density, it was asked about osteoporosis earlier, so exercise is going to slow the effects of osteoporosis or even osteopenia, which is just early onset osteoporosis. And then exercise is also going to benefit mood, sleep, and cardiovascular system, right? So, if at the end of the long day you're actually winded because you did a lot of vacuuming or walking around, you being fatigued is going to leave you at a higher risk of falling. Poor sleep is going to be another one that leaves you at a higher risk of falling. Your attention is lower, your reaction time is lower. People are a little bit more carefree when they're tired. And same with mood. All right. So the power of exercise. So really we're looking for about 150 minutes of physical activity. Right. This could be anything like walking, vacuuming. Those would be considered moderate levels of activity. Or 75 minutes of vigorous intensity aerobic activity. That would be something like pickleball, strength training, going to the gym. Anything like that would be actually vigorous intensity activity, right? We're only seeing that about 96% claim to have met those guidelines, and actually only about 10% actually met them when you sat down and counted how much they actually exercised, right? All right, so this is just more about how many people are actually meeting those guidelines, right? There's a lot of people out there that say they meet the guidelines and they just don't, whether they're unaware of it or, it's usually they're just unaware, right? So again, this is moderate levels of activity, walking very briskly, doing some heavier cleaning, mowing the lawn, whereas heavier, vigorous activities would be hiking, shoveling snow, jogging, pickleball, I would include in there as well. Right. Here's some exercises we might use to improve strength, whether it's at physical therapy or your own workout program. So you've got the most functional exercise, in my opinion, which would be squatting. You know, a lot of people say, I don't squat, right? But you go to the bathroom 6 times a day, that's squat. Okay, you get in and out of your dining room chair, a really low couch, that's squatting. So the best way to actually improve at getting in and out of a couch or up and down from the toilet would actually be to practice and to squat. The other one would be step-ups, right? And then the next one would be heel raises, so that's just going up on your toes and working the backs of your legs. Here's some to improve balance. Like I said, I'm going to send some of these over to you if you wrote down your email on that sign-in sheet, so that you have access to some of these exercises. The one thing I will say about exercising and improving balance at home is just to make sure you're in a safe environment. You're next to a countertop where if something does go wrong, you can grab onto the countertop as opposed to being on your back on the floor. All right? But basically, like I said earlier, the best way to improve your balance is to actually practice and stress it. Okay? The human body is incredible in its ability to respond to stress. Okay? Meaning, if we don't stress our bodies, it's going to do the same thing and start to become weaker. Right? And unfortunately, we all become weaker a lot faster than we become stronger. We see that people lose a lot of muscle mass and aerobic capacity, your ability to do aerobic activities, a lot faster than they get it back. So if you're laid up for 1 week, it could take you up to 4 weeks to get back to where you started. Right? Here's some more balancing exercises that we do. Tai Chi is a great one, right? We all have access to a lot of different programs that do Tai Chi. I know they do it up at the rec center up on the north side. They have it at the Phoenixville YMCA. There's other organizations that offer Tai Chi, but there's a lot of good evidence to show that balance is supported by a lot of things that you do during Tai Chi. You're constantly moving your body weight through your center of mass, right? So the takeaway points that I want to leave you all with would be to set yourself up for success. So first of all, start in the home. Most falls happen at home, right? Just like most car accidents happen within 5 miles of your house, most falls actually happen inside the safety of your home. It's because you feel more comfortable there and you're a little bit more careless. It's because things are more unpredictable than you realize, right? Your husband moves something or your spouse moves something that typically is not there, and all of a sudden it's there, right? So look at your home and say, that area rug, I love it, but maybe it's not the best for me right now. I need a night light because I go to the bathroom twice in the middle of the night, and I just go right to the bathroom and I can't see, right? That's another big one. Exercising is the best way to sustain yourself, to improve your strength, to improve your balance. Exercise is the first thing that is recommended for anybody with musculoskeletal issues, cardiovascular issues, just like balance, okay? And if you're currently inactive or at a high risk for falls, consult a physical therapist, consult your primary care physician. We can kind of tell you where you stand in terms of your risk for falling. Some of you came a little bit early and we did some fall screenings that only took about 10 minutes. But we can find a program that's more tailored to your specific needs, especially if you have a history of hip or knee or back issues. We can kind of take that into consideration. All right. To identify if you're appropriate for PT, if you saw some of those exercises up there and you got concerned, there's a good chance that you need PT. All right. So if you're concerned about having to balance on one foot, if you're concerned about having to put one foot in front of the other, you may have an issue with balancing. All right. If you've had falls in the last 12 months, that would be another one. If you're just afraid of falling, like we talked about, the more fearful you are, the higher risk you are at falling. Right? We can help with that. Joint or muscle pain, a lot of people change the way they move because they're feeling a certain way. Right? If my left hip hurts when I put a lot of weight on it and I start walking around putting weight on my right side, all of a sudden I'm altering the way my body's moving and putting myself at a higher risk of falling. Right? And then if you require a medical professional to initiate an exercise program, that's where physical therapy can help. All right. There's some good websites on falling and on just aging in general. Like I said, my name is Dr. Jeff Kurtz. We're currently treating 5 days a week at both Collegeville and Phoenixville, amongst the other locations. If you have any questions that I can address specific to your needs, feel free to call, email. I have business cards up here in case you don't want to have to remember all this stuff. And please just reach out. Right, we're here to be a resource. You can use us as much as you want to or as little as you want to. All right. Any questions? Yeah.
When you mention exercise, I think I agree with you, that seems like a good idea. Do you have specific exercises that you recommend, or do you say, do you say tennis, do you say floor exercises, do you say weight bearing, or do you say all of those?
The best, yes, the best exercise for somebody is the one that they enjoy, right? So I don't take somebody that does not enjoy strength training and just haphazardly say, well, just go to the gym, because that person's not going to do it, right? Versus somebody that doesn't play pickleball, I'm not going to throw them on a pickleball court. But if pickleball gets you moving and you enjoy it, and you're going to be the most compliant with that exercise, then go play pickleball, right? You know, it's really just what is going to get you moving the most. In a perfect scenario, I would say diversification is great. So if you like walking and you like playing pickleball, then walk and play pickleball. You know, diversifying yourself different ways is the best thing you can do. But you can't force everybody to do the same thing and all fit a mold. So yes, the perfect scenario would be diversifying somebody. So getting them to strength train, walk, and play a sport, that would be great. Right? But the best one would just be the one that somebody wants to start with and gets them moving. Right? You know, some people recommend yoga. Not everybody loves yoga, but so for you to go and tell your family member, well, just do yoga, it'll help. That's not the best thing for that person necessarily. Right? Any other questions? Yeah.
What's the speed of just what you would consider a good gait? On your phone, it'll tell you how.
Yeah, it totally depends. You know, 3 miles an hour is a good place to start, right? You know, you can actually get very specific normative values of what somebody your age walks, right? You can get a normative value of what somebody your age with Parkinson's walks. So those are something that you can kind of compare yourself to kind of see where you fall. Obviously, there's a wide range of how fast somebody should and can walk. Comorbidities, you know, BMI, all those sorts of things play into it. And those things can be found online as well. If you have specific questions, I can find that answer for you.
What about walk? Some people like to hike with the sticks, and I prefer my arms moving. Is there a difference?
Yeah, so you can actually, you know, use the sticks in a way that it's still moving the normal, you know, normal way somebody would walk. So most people walk opposite arm, opposite leg. And the sticks are actually good because it allows you to do that. If you're not doing it that way, you're not using the sticks correctly, and it might actually be hindering you. Just like I spoke about assistive devices earlier, if you're not using the assistive device correctly, then it's going to hurt you more than it's going to help you. So if somebody walks around using a cane, but they're actually not putting the cane down at the right time, or holding it in the right hand, I can't tell you how many people come in holding their cane in the wrong hand. And some people wouldn't really think about, well, what hand should I hold it in? But those are all answers that you can get as long as you ask the right person. Does that answer your question?
Yeah, thank you.
Yeah. Yeah.
Yeah, when you use a phrase like 3 miles per hour, it depends how many hours you're doing that too. You didn't address that. So, for example, for me, I'll go out and I just did 7 miles this morning, and I'll do that at 15-minute miles. So that's probably pretty damn good for someone my age, okay? Because I can't run anymore.
Right.
There's a time with age, and the joints won't take it anymore, where they can walk like that.
Yeah.
And
like I said, walking faster is great.
And the distance also matters too.
Yeah, it does.
And the heart rate also matters too,
It depends what you're training for, though.
to
You know?
live.
Yeah.
So when you said when COVID came, I made a commitment to myself when COVID came that I would go out 3 times a week and do an hour and a half.
Mhm.
Because I know it's dangerous to isolate like that, you know,
Right.
regardless of COVID or not, just get out and do that. And the other thing was with shoes, I think shoes are, gotta be careful with shoes too, because I took a spill exercising wearing a brand called Hoka,
Right.
which were terrible because they grabbed too
They're
much.
big and bulky, but people like them because they're comfy.
Well, I went to a running place, they said, oh, they're good shoes, but next thing you know, they stop you suddenly, you're moving at speed
Right.
at a pretty good gait, guess what? So all I could do was tuck and roll, and I
Right.
cracked the clavicle.
Mm.
And it healed with no problem, but it's,
Yeah.
the point is that like the kind of shoes you wear too are also important too when you get older.
Right.
And the third thing I wanna say is that a good friend of mine is much older than me, he had Parkinson's and he had the problem with the gait with walking. And I said to him, why don't you take my trekking poles? And as soon as he put trekking poles in his hand, he had no problem walking,
Yeah.
which is interesting, because then his brain was focusing on the motion with the trekking poles, so I thought
Yeah.
that was interesting.
At the Phoenixville YMCA, we run a program called Pedaling for Parkinson's. They meet every Wednesday and they ride the bikes, they go through
Yeah.
guided exercise. It's just a nice way to get bodies moving. But you know, outside of Parkinson's, we see a lot of people with just worsening posture, okay? Or we see a lot of people who take small shuffled gaits, their feet are really wide like this, right? And a lot of people will look at them and go, why are they walking like that, right? Or why is that older person starting to become a little bit more hunched over, right? The big reason people do that is actually they want to get closer to the ground, okay? They want to do what my son does, which is reduce your center of gravity, because it's a little bit easier to balance, right? If you're all top heavy, you have a lot of weight upstairs, it's a little bit easier to lose your balance. So you'll actually see a lot of people start to get closer to the ground just to bring their center of gravity closer to the floor. They'll also widen their feet so that they get a little bit wider stance and a wider balance, because again, that's going to improve your stability a little bit more. And then the other big reason postures are getting worse is just we're all, you know, constantly down here all day. So that's just in itself its own problem that we can also fix with PT, right? So I'll respond to your point about, you know, walking 7 miles. That's fantastic, and to be able to do it at 4 miles an hour, that's even better. But you wouldn't take a marathon runner, or I'm sorry, a sprinter, and ask them to run a marathon, right? So a lot of people say, well, how much should I be lifting? How much should I be walking? It's really what you're training for, right? If somebody wants to be able to lift really heavy weights, you got to lift heavy weights. If somebody wants to improve endurance, though, or improve just how long they can stand for, lower weight and higher reps would be important. So somebody that wants to walk really fast, I would say, yeah, walk 1 mile, go 4 miles an hour.
Sure.
But if you just want to be able to walk far, take your time and just go, you know, for a prolonged period of time. It's basically just identify what you want to train for, and then you modify how you train for it, right, to fit those needs. Any other questions? I think we have about 5 minutes before everybody wants to head out.
And we close at 8, so we're good.
So I'm going to stick around to answer just personal questions. I also have the business cards. And if you didn't sign in, please do, and I'll send you exercises. Okay? Thank you all for
Okay.
coming.